We're going to continue on now with parenteral medication administration. Parenteral means outside of the GI tract. There are meds that we give parenterally because they're absorbed better, and they also are more effective, potent. So when we're giving parenteral meds, we teach students to always use a two-handed technique, except when you're utilizing an insulin pen or when you're doing a Z-track IM method, which we'll talk more about in a moment. Also, again, of course, gloves for parenteral med administration. They've always been gloves. It's always been the use of gloves, but always wear a glove when you're giving a person an injection. Remember that when you're cleaning the injection site, you need to take an alcohol wipe and make the site as aseptic as possible from cleaning from the center outward, 2 to 3 inches, to clean all that transient bacteria off the skin. Also, remember that there are different forms that medications, parenteral meds, come in. Medications will come in a vial. This is a multi-purpose vial that has a rubber stopper. Some medications will come in the form of powder, like this vial has a powder in the bottom and then diluent on the top, and we'll show you how to use this. Remember, some meds are not, they really will, they're not stable in solution for a long period of time, so we have to mix the powder with the diluent right before we give it. Some medications come in ampules, which are glass flasks, and that's because sometimes medication will stick to the rubber stopper in the vial. So when you're using a glass flask, you need to break the top off and draw up the medication with a filtered needle, because there's always a chance of shards of glass going down into the medication. So you use a filtered needle to draw it up, and then you'll change the needle based on the use parenterally. We also have some medications that come all pre-measured to go, like this medication here, which we're going to be giving today. And then we have sometimes some medications that come in pre-filled cartridges, which I'm sure you already talked about in your lecture. And in order to engage those, we have to put them in a cartridge. Today, we're going to be giving subcutaneous medications, and we're going to be giving intramuscular medications. Whenever you give an injection, you need to make sure that you identify the appropriate site, especially for intramuscular meds, which we'll get to in a moment. There are intradermal meds, subcutaneous meds, and there are intramuscular meds. Intradermal medications are used predominantly for allergy testing and the 2-step PPD that you all had to go through. The purpose of an intradermal injection, remember, is it's a very fine needle, 27 gauge, 1/4 inch to 1/2 inch. And the bevel of the needle, what that means is the opening of the needle. When you're giving an intradermal medication, the opening of the needle needs to be facing upwards. And when you're giving an intradermal medication, you want to make sure that you're going at a 15-degree angle and just under the skin. And you're giving like just maybe 1/100th of an ml of an allergen to get a response. So you're going to learn how to do that. You have to be certified in acute care to do that. But predominantly, intradermal medications are used for allergies and PPD. Now, the medications you're going to be giving a lot of are subcutaneous medications, heparin and insulin and low molecular weight, anticoagulants. Subcutaneous medications are best absorbed in the abdominal fat, but in the fat of the body. In the posterior arms, anterior thighs, and 2 inches around the umbilicus in the abdominal fat. The maximum amount that a nurse should give subcutaneously in one injection is 1 ml. The syringe is 25 gauge, 1/2 inch to 5/8 inch needle. You go in at a 90-degree angle for most patients unless they're really thin, and then you're going to go at a 45-degree angle. When you're giving anticoagulants like heparin or low molecular weight heparin, the studies indicate that they're best absorbed in the abdominal fat 2 inches around the umbilicus. You're going to give a lot of insulin subcutaneously. In the back of the arm, abdominal folds here, anterior thighs where there is some adipose tissue. You need to rotate sites with your insulin so you don't get a thickening of the skin called lipodystrophy. Okay, the next route is intramuscular. Intramuscular medication goes into the muscle. You can give up to 3 mLs intramuscular of a more irritating medication. You cannot do that with subcutaneous medications. The 3 sites that we give medications are in the deltoid, the vastus lateralis, and also the ventral gluteal. It is no longer acceptable to give medications in the dorsal gluteal area. Too many adverse effects, nerve damage, and other things happened in the past. So, 3 areas. The thing about intramuscular injections is that the muscles are surrounded by bones. So you must palpate the appropriate bone to get the injection in the muscle because you don't want to hit the bone and you don't want to cause nerve damage. Also, there are rules you need to learn. Deltoid, you're going to use, first of all, for all intramuscular injections, 21 gauge to 22 gauge, 1 inch to 1 1/2 inch needle. So, if you're giving a medication in the deltoid, you can only give 1 ml, and you're going to use a 22 gauge needle, 1 inch needle. All vaccines are given in the deltoid. Now, if you're going to be giving medication in the vastus lateralis, the muscle here on the side, the vastus lateralis, by the way, the palpatory bones are your head of your trochanter and the side of your patella. And the vastus lateralis, you're going to palpate those bones, and then it is the middle hand outer aspect is your vastus lateralis. I didn't talk about the palpatory landmarks for the deltoid, but the acromion process is where you're going to palpate that bone. And then 2 to 3 fingers below is where your deltoid muscle is. And if you lift it up, you can see it. It's kind of shaped like a triangle. Now, when you do your ventral gluteal, we're going to demonstrate on the mannequin, you have to palpate the head of the trochanter and abut the anterior superior iliac crest or spine. And we'll show you on the mannequin. So when you're giving a medication in the vastus lateralis, you can give up to 2 mLs, 22 gauge, 1 inch. When you're giving a med in the ventral gluteal area, which is up in here, you can give up to 3 mLs, and you're going to use a 1 1/2 inch needle because it's a pretty hefty muscle. So to review one more time before we start dispensing medications, you're always going to palpate your IM sites. When you give a medication in the deltoid, 1 ml, 22 gauge, 1 inch. When you give a medication in the vastus lateralis, up to 2 mLs of injectate can be given, 22 gauge, 1 inch needle. And if you're giving a larger amount, up to 3 mLs, which is the max that you can give, 3 mLs, you're going to use a 3 mLs for the ventral gluteal, 22 gauge, 1 1/2 inch needle. The other rule for IM injections is you're going to spread the tissue when the needle goes in so that you can get it inside deep into the muscle. You're going to aspirate, pull back on the plunger to make sure that that medication is not in the vein. Because if it's in the vein, you're giving way too large of a dose, IM, and it would be really cause an adverse effect. So if you pull back and you get blood in your syringe, it indicates you're in a vein and you're going to throw that out and start again. Also, for subcutaneous, which I didn't say, subcutaneous meds, you want to give it in the fat, so you're going to squeeze and pinch the fat. IM, spread the tissue to get it deep into the muscle. So in essence, those are kind of the rules that you should know. Vaccines are the only intramuscular med per the CDC that you don't have to aspirate. Other injections, either in the deltoid, in the vastus, or the ventral gluteal, you need to aspirate. So what we're going to do today is we are going to administer medications, injectable medications, to our patient. And we're going to give our patient 2 types of insulin just to demonstrate. Typically, we just would use probably rapid-acting insulin, but we're going to use our short-acting insulin and then our rapid-acting insulin utilizing a pen. We're going to be giving Lovenox, an influenza vaccine, and a Solumedrol injection IM. And we're going to also have Monique administer those medications, and I'm going to play the role of the faculty member. Remember, always, when you are getting rid of a needle that's been in the body, you never recap. They all have a safety cap. You're going to lock it in place and always use a one-handed technique to get the contaminated needle into the sharp so you don't pick yourself. Okay, there you go, Monique.
So first I'd start preparing my meds in the med room.
Yes, you would.
And I'm going to prepare medications for Francis Red 3170.
Francis Red 3170. Once we get to the room, we'll check it again.
Francis Red 3170.
Okay.
And so I'm going to prepare his regular insulin. And I'm going to check this against my MAR. Before I know if I can give this, I need to check his blood sugar.
Very good. You're making the assessment. Yes.
On my lab sheet.
Yes, it is.
And his glucose was 234.
What's the normal glucose?
70 to 100.
Okay, so his sugar is high. He needs his insulin. Very good. When does that regular insulin peak, nurse?
2 to 3 hours.
Very good, nurse.
And then I'm also going to administer his Humalog, which is in a pen.
Yeah, and that is a rapid-acting insulin.
It is.
And when does that peak?
1 to 2 hours.
Very good, very good.
And his sugar was 234, which is a sliding scale.
Correct.
And so I will be administering 4 units.
Why do we give sliding scale insulin in the hospital before they eat?
That covers the amount of sugar that he'll be consuming in his meal.
Very good. Thank you.
I'm going to be giving Lovenox, Subcutaneous, 40 milligrams. That is to help prevent blood clots.
Very good.
Okay, I'm going to be giving him his influenza vaccine, 0.5 mLs, and his Solumedrol steroid, which I will need to reconstitute.
And maybe you want to come over here so that he can see how you prepare. And I will bring the syringes over for, the syringes are right over there for you.
I'm going to identify my patient. Hi, Frances.
Hi there.
I'm here with some more medications for you. Could you tell me your name and date of birth?
Frances Red, 3170.
Okay. So we're doing 70.
Oops, sorry. It's not doing it. It's okay.
We will be.
All right.
Okay.
I'll hold that for you.
So Frances, I have here today your regular insulin.
How much am I getting today?
So you're going to be getting 8 units.
8 unit
And this is high alert, so I would need to have another nurse double check.
All right. So we have 8 units. Can I check your vial, please? And the blood sugar was what, nurse?
The blood sugar was 234.
Okay.
I'm going to select my insulin.
Low dose.
Syringe.
Very nice. 8 units. Perfect. Let's see if that scans for you. Let me get ready. Good. Great. Okay. So anytime you have a multi-purpose vial, you're going to clean the top, and you're going to always administer air into the vial, which I didn't explain. It helps to draw back your medication, creates a pressure in there without air. 8 units, great. If the syringe leaves the medication room, it needs to be labeled. That's a Joint Commission standard along, even though the vial is with you, because you need to scan it. And what she's doing is capping on the table instead of doing this. Very good. 8 units, perfect. And where can you give this to this patient?
So this is going to be subcutaneous.
Okay. So he normally gives insulin in his abdomen at home, and he'd like to have it behind the arm.
Okay.
The arm over for you. She's cleansing from the center out, and is going to keep the alcohol widget with her. Are you going to pinch or spread, nurse?
I'm going to pinch.
Okay, pinch.
Straight in.
Good. Two-handed technique, holding the syringe and then pushing in the contents. Good, very good. And she's going to put over the, okay, put the alcohol over the, yeah, just make sure that it stays in. Great, good. One hand behind your back, very good. There we go. Right. Right. That's that insulin. Okay.
Next, I have his sliding scale.
Okay.
It was 234.
234, and you're going to be
So we're going
giving
to double check again against my mark. And I'm going to give 4 units.
4 units. And the sugar was?
234.
Okay. 234. Yes, it was. Very good.
I'm going to cleanse my pen.
Good.
I'm going to prime 2 units.
She's priming the pen with 2 units to clear it and to engage the needle to give an accurate dose.
And I'm going to set my 4.
4. Okay. Novolog. Okay. Oops. 4. Very good. All right. And you can give this to them in the abdomen. And because of the density and the heaviness of the pen, you can use one hand with this. Pushing it in.
Pausing.
Pausing. And your alcohol wipe is right there. Great. Okay, and you will know that you've given the medication because the window is now red. The needle retracts in, so she can take it off. This way, it's not going to pick her, and then all that's thrown away is this, not the pen.
Have your Lovenox.
Some gauze. And you've done some gauze, okay? Okay. Here's some gauze.
And double check this against my mark.
0.4, right?
0.4.
Okay.
I'm going to put this in the abdomen for best absorption.
2 inches around the umbilicus. Okay. Okay. And this medication is for?
This is to help prevent his blood clots.
Good. Yes. Notice he's got a VTE.
Straight in.
Straight in 90 degrees. Two-handed technique. And gauze on the puncture wound. Pressure for 30 seconds to a minute to prevent the med from tracking up and causing a bruise. Good. And this, you can show the camera, this is a retractable needle. You just push on the plunger and it retracts, which is making it safer when you go to the needle's sharps. Okay, she has 2 more IM medications to give. An influenza vaccine.
Influenza vaccine is going to be next. I'm going to use a 22 gauge 1 inch.
What is the amount of injectate that you're going to be giving?
I'm going to be giving 1/2 of an ml.
Good, so you can give that in the deltoid. Great. Now, before we give vaccines, they have to sign a consent for the flu vaccine, and we also have to document the lot number in the clinical environment. She's drawing back 0.5 ml of air. She's going to put it through the bullseye in the vial. Okay, and then it's going to draw back her 0.5 ml. She's scooping the cap on correctly. Just get your deltoid ready for you. Okay.
And we always verify with our faculty.
Yes, 0.5. She's going to palpate the acromion process, which is right here.
2 finger widths.
Below. Good.
I'm going to spread.
Spread for IM, pinch for SC. Okay, straight in.
I'm not going to aspirate. It's a vaccine.
No aspiration for a vaccine, correct. Yep. Needle cover on. Great. If you're doing vaccines in a clinic, they make you put a Band-Aid over it.
And the Solumedrol.
This is a powder, and the Solumedrol came, she did her math over here. The Solumedrol came in a dose of 100, the desired is 100. What we have is 125 milligrams, is what we have on hand, per 2 mLs. And this is a powder, so remember when you have a powder, I'll get that for you if you wish. It can be hard with those big gloves for you. A little biscuit. So she did her math. Desired 100 over. Gosh, God. I think you can. Yeah, I'm getting it. Perseverance. There you go. I think you can get through. So her desired is 100. She has 125. The volume is 2. So 100 divided by 125 times 2 mLs equals 1.6 mLs. So where can you give this?
It's over 1 ml and he's an adult, so it needs to go in the ventral gluteal.
Perfect, ventral gluteal.
With a 1 1/2 inch 22 gauge.
And will you aspirate with this?
I will.
Great. So she pushed down on the cover, and it puts the diluent into the powder. You shake it until it's clear. And now she's going to be drawing 1.6 mLs of steroid. And why is this patient on a steroid? Let's look here at the diagnosis.
So he has a pneumonia, he's got a VTE, he's got lots of inflammation going on in his body.
Super. And what will that do to his blood sugar?
It's going to increase it.
Very good. Thank you very much. Okay, so he's going to come over towards you, correct?
Correct.
And I'm going to hold him.
So I'm going to palpate the acromion.
Yeah, so left leg, right hand. Right leg, you're going to palpate with your left hand. So this is his left leg, you're using your right hand, correct?
Greater trochanter.
Greater
and
trochanter.
I'm going to feel for the crest, his iliac crest.
Yes.
Spread my fingers, and that is going to be my target right there.
Correct.
I'm going to
mark the target with a little alcohol widget, and you can leave it there to mark your spot. Yep.
I'm going to
spread. 1, 2, 3.
Aspirate.
Yep.
Blood.
Pause. Great. So if you had gotten some blood, what would you have done in the syringe?
Discarded this and started fresh.
Okay, sounds good. You can come on over and chart your meds. You always want to chart and document your parenteral medications in regards to site.
His regular insulin. This is his right arm.
Right arm, regular insulin, correct.
I have his sliding scale, which is his right abdomen.
Right abdomen, great.
I have his Lovenox, which was his left abdomen.
Left abdomen, great.
I have his influenza, right deltoid.
Right deltoid.
And his Ventral, which was his
Left deltoid.
left ventral gluteal.
Left ventrogluteal, sorry. Correct. Very good. All right. So that ends our parenteral med administration. Thank you very much.